Ocean FM, the perfect music mix. Jackson Brown there, and You're a Friend of Mine. Okay, it is Wednesday morning, so that means we're joined in studio by Gabriel McSharry, nutritionist and medical herbalist. And of course, if you have any questions for us, you can text us now to 083 3500 530 or give us a call at 0818 365 500. Gabriel, this morning we are going to be talking about acne and rosacea, because we had a lot of queries in over the past 2 weeks about it.
That's right, Margaret. So there's a number of forms of acne, and but I suppose the most common ones are acne rosacea, acne vulgaris, and so we'll kind of talk more about them today. Now, possibly we'll cover acne rosacea first, because there was a lot of callers inquiring about that in the last few weeks. And maybe to mention, the cause is currently unknown. It's more common in women than men, maybe a 3-to-1 ratio. However, the men that do get it, it's a more severe form. But generally, rosacea it occurs later in life. So you're talking between 30 and 50, that general age group. There's usually no blackheads or whiteheads as such. It's more of what they call in medicine erythema. So it's like a rash, a red rash that can be... So it's like a
real red sort of...
Yeah, generally around the nose and under the eyes. And what they call it is a butterfly rash. So I guess it's the shape of a butterfly with its wings spread across the face. So that's the classical, but it can be all over the face. And it's mainly bright red, and it's... there's a lot of heat there, and it can be in the nose too and cause a little bit of swelling.
And does it affect both male and female, the rosacea?
It does. The rosacea does, but it's more common in women. So, but it does affect both sexes. Now, the implicating factors of the condition are things like alcohol, low stomach acid. Is one of them, and also a possible deficiency in B vitamins. So with that in mind, the treatment is
the herbal medicines then that are
is geared towards the kind of implicating factors, again, because we don't know what caused it exactly, but things to avoid would be vascular stimulants, and there are things like alcohol, certain spices that heat up the body, extremes of heat in the environment, and excessive sunlight too tends to exacerbate it. So people with rosacea should really avoid them. On a herbal front, there's no specific treatment, but generally herbs for the digestive tract, bitter herbs, they're very good for increasing the acid in the stomach, and that can address that. Also immune herbs and what we call alterative or lymphatic herbs, so just general cleansing. So there is some dietary recommendations. I'll talk about it a little bit later on when we go into more detail on a more common form of acne, which is acne vulgaris. So acne vulgaris it presents quite differently than rosacea, in that it tends to present earlier in life, so around puberty. And with this, we kind of have a better handle on the cause. So it's a disease of the sebaceous glands in the face, and it's either a non-inflammatory form, which presents in the classical blackheads and whiteheads, or an inflammatory form, which is cysts, or better known as pimples or zits. Are
there medicines for that then, herbal medicines?
Yeah, definitely, yeah. But just first of all, I talk about maybe the possible cause of this, or the onset. The onset is multifactorial, and it's a combination of factors. So hormones play a role. As I say, it generally first starts around puberty in both sexes. It produces sebum in the pilosebaceous glands, but that traps bacteria, so it's kind of there's an infectious component as well. But generally begins at puberty because of an overproduction of androgens. So androgens are the base hormones, so testosterone and estrogen. Now this one, unlike rosacea, is more common in males.
And would that acne be the acne, that young teenage boys get, or girls, and they're complaining about the spots on their face and what am I going to do with them? Yeah,
so that's the acne vulgaris, and it's quite common, and I think it's comprised of 25% of all visits to dermatologists. So it's quite a common thing. There's also obviously an emotional thing, like it affects self-esteem, and when they're at that age too, they're quite
can't go out because I have this spot.
Exactly. So it mainly affects the face, chest, back, shoulders, other things to think about is things like oil-based cosmetics. So certain type of makeups and stuff like that can make it worse. Diet, which I'll talk about, certain type of chemical compounds, so like hormone steroids, and there's chemical compounds called halogens. Now they're chloride, fluoride, bromide, iodide. They're all chemical halogens in the periodic table, but they seem to make it worse too. Other type of industrial pollutants and fatigue and stress as well can make it worse.
Can make them flare up worse, yeah.
So, to do with the treatment on herbal medicine front, we'd use herbs for like hormonal herbs, antiseptics, immunostimulants, liver herbs, or blood kind of cleansers. So the type, like as with the hormonal balance, I mean, generally in conventional medicine, say the females are prescribed the pill, and this tends to increase estrogen to oppose the androgens. So on a herbal medicine front, however, we can use herbs that can increase estrogen, like black cohosh and angelica, shatavari. And in both sexes, the likes of Vitex and saw palmetto will have this kind of hormone modulating effect, and that tends to improve things a lot. On an antiseptic level, we use antiseptic herbs. There's one called Oregon grape, and this is a recent pharmacological investigation showing anti-inflammatory, antimicrobial, and anti-sebacic activity. So that can be used as kind of a wash topically. And there's other herbs then we can use to kind of cleanse the body, like a kind of a detox, so dandelion root and stuff.
Yeah, and people are saying, if you've got spots or rash on your skin, if you drink loads of water with maybe a little squirt of lemon and stuff, is that all?
Yeah, definitely.
Does help.
Yeah, water's very important, obviously, to hydrate the body, but a little squirt of lemon, that's a recommendation where some people drink it in the morning to kind of detoxify the body, and it actually works on the liver, and it does can have an effect of releasing toxins. So that'll be beneficial, yeah.
It does help. Okay, we have a quick break to take, and we're going to be back. When we come back, we're going to talk about the nutritional guidelines that would help if you suffer from acne or rosacea.
Ocean FM.
The perfect wine selection, with thanks to Hogden Brothers. Food and Wines, O'Connell Street, Sligo. Largest stockist of wines in Sligo.
Ocean FM. Keep up to date with oceanfm.ie.
Ocean FM, worldwide on the web. Bravo!
Final, while Bundoran and Glen must meet again. First past the post every time. The Donegal Post, out now.
To have your say, call the Northwest Today comment line on 0818 365 500. Text your comment to 083 3500 530.
And you're welcome back to the programme. We are in the company of Gabriel McSharry, nutritionist and medical herbalist. Now, the nutritional guidelines that would help people who suffer from acne and rosacea.
Yeah, so bowel toxemia is something that has to be taken into account here, and it was suggested that 25% of acne sufferers have toxins in the blood that are derived from the intestine. So definitely anyone who has acne, what will improve it is improving the digestion, so bowel function and also the acid in the stomach. So if they have bloating and flatulence and stuff like that, that needs to be addressed too, and it'll have a beneficial effect on the skin. What very important here is to reduce or cut out sugar. So low sugar diet is very beneficial, and there's some studies done on glycemic index of foods, and it's possibly to do with that high sugar diets will affect the hormones, and they're just bad for the body in general, but they're also bad for the intestine and the microflora in it. So it'd be good to go on low sugar diet, cut out all processed sugars and processed grain-based foods, and that'll be very, very beneficial. Things like fats are important here too, because the sebum, like the stuff that the skin secretes, is an oil base or a fat base, and so it's important to have healthy fats in the diet. And there's a lot of misconceptions around this area of what's healthy fats and what's not, but definitely the omega-3 fats that you get in fish oil or cod liver oil, they're good fats, and everyone with acne, be it rosacea or vulgaris, they should take a fish oil supplement and try and eat more fatty fish in their diet. And fats to avoid would be like your man-made oils or fats that have what we call trans fatty acids, and they're like margarines, heated oils, and anything that uses heated oils. So that's your potatoes and chips, unfortunately. But it's important to get the omega-3s up. Also, on a nutrition level, there's some clinical research to show that people with acne may have low zinc levels. So foods that are high in zinc are important. Vitamin D, there's some studies showing vitamin D improves the severe form of acne. So, and it's common for people to note that their skin improves in the summertime and it's worse in the winter. And that's possibly due to vitamin D, because our best way to get vitamin D is we produce it in our skin from sun exposure. But it's also in foods, and where it exists in foods is in the healthy fats again, you know. So an old-fashioned form of vitamin D and also vitamin A and good fats is cod liver oil. So a good quality cod liver oil supplement is important. And now cod liver oil also contains vitamin A, and interestingly there's a pharmaceutical drug called Accutane that a lot of teenagers in the past were put on who had acne, and it's a derivative or an analogue of vitamin A, but it has pretty serious side effects. So vitamin A itself can be beneficial, you know.
Okay, and then change the lifestyle or anything?
Yeah, definitely lifestyle factors. Regular exercise is good. Now, exercise is great for the body anyway, but specifically with exercise, you build up a sweat and you perspire. So when you sweat, you obviously release toxins through the skin, and obviously if there's a build-up of bacteria or toxins in the skin, when you sweat, you'll sweat some of that out. So people who are athletic, it's good to build up a sweat. People who are not, I'd encourage maybe saunas or steam rooms or hot baths just to get the sweat going, and then maybe a scrub with a loofah or a cloth just to kind of clean off the oily secretions, you know.
Okay.
Also, as you mentioned earlier, things like water is really important, you know, to get a lot of water in the diet.
All right, now we've questions in about psoriasis, but you're saying psoriasis and eczema would be a bigger
they're a
topic,
different, yeah, they're skin conditions, but they're a different class than acne. They're more so of an autoimmune condition, and it's a big topic, and they're very common conditions, so we can cover that on a show down the track, definitely.
Okay, and there's a lady or a person on about hot legs. Hot legs. Hot legs. They're actually, I suppose their legs, I don't know, is it that their legs are getting warm, or it's the way I've said it?
Yeah, I'm not too sure what to do there.
Yeah, they're any cure for very hot feet and legs. It must be some sort of condition, is it? Or
Yeah, well, I guess in this case you'd need to distinguish what's causing the heat in the legs and the feet, and I mean it could be a lot of things. I'd like to know.
maybe if they suffer from a condition or something, might lead to
or if the woman gave her age, would she be in around the 50s, and it could be menopausal, kind of where the body heats up quite a bit.
Something like that,
and especially at night time, some people get hot feet in bed, you know. But in that case, on a herbal medicine, it'd be for herbs for the hormones. But it'd be important to distinguish why her legs are hot.
Why she's got hot. Okay, and we've people wondering about their, what would be good for low and their immune system, and also it's something that we'll dwell on as well, maybe preparing for the winter, I suppose, to
definitely
keep away the colds and flus and that sort of thing.
Definitely how to optimise the immune system for the flu season that we're coming into, and we'll mention some herbs that are really good for the immune system, and some lifestyle activities that'll keep it robust, you know. Okay.
Well, Gabriel, you're back with us next week, but we've listeners ringing in. They're wondering how to contact you.
Yeah, so you can contact the clinic for a private consultation on 07191 22832. That's 07191 22832.
Okay, and they can contact you there.
They can.
Okay. You're back with us next week again, and I know we have questions in, so what we'll do is we'll put them all together, we'll give them to Gabriel, and over the coming weeks we'll deal with all the questions, because it takes time for some of these topics that we need to go through.
See a store for details.